Excellent. If you would introduce yourself for the record, please, and provide us your testimony.
Right. Good afternoon. My name is Amber Burkhart, Policy Analyst at the Colorado Hospital Association. I'm here on behalf of our 103 member hospitals and health systems today. Thank you for the opportunity to provide public comment on this proposed rule. I'd first like to thank the Adult Protective Services staff for their extensive and meaningful stakeholder process on these proposed rules. CHA has participated in this stakeholder process throughout all of the meetings, and we just want to thank the staff for their great work on that. I am here today to share a few of our outstanding concerns with the proposed rule as drafted. Just for some context, 1 in 16 jobs in Colorado are in the healthcare sector, and hospitals alone employ more than 75,000 Coloradans and generate over 184,000 jobs. In 11 of 14 regions in Colorado, we are the #1 employer. So for example, it could be a critical access hospital who employs 100 to 200 individuals in the southeast region of Colorado, or a large urban health system that employs over 10,000 Coloradans here in the metro area. And so that just provides some context in terms of what this rule means to our hospitals and to the hospital communities. CHA has 3 primary concerns as drafted. The first is with the definition of direct care as previously discussed by Mindy. I think our concern is that the definition as drafted in rule, included in rule as included in House Bill 17-1284, is that it is very broad, and it could apply to anybody working in a healthcare setting. So I would encourage you to look at that. And while we can't change the definition in statute, we were concerned, however, throughout the process that the bill was going through before it was enacted, and we shared our concerns with the department. And I have a copy of the feedback they provided to us. Just want to we said we are concerned with the potential definition of direct care. And the response from the department is the intention is not to include janitorial, kitchen staff, etc. And so I just want to encourage the board to consider or work with the department. And I know we can't change the definition, but maybe we can include in the rule something along the lines of allowing a facility to further define direct care through internal policy, something that creates some protections within the liability scheme, so that if there were to be a case where a hospital chose not to screen for the janitorial staff, that they are protected and wouldn't be cited by the Colorado Department of Public Health and Environment had they chosen not to select those individuals because they didn't fit within the definition of direct care. And I think that follows the intention of House Bill 1284. Second, our third concern is around timing. We've heard a lot about this. We just want to ensure that the department works, and I know they have that intention, to just ensure that there is efficiencies within trying to get the results back to employers as fast as possible. And then lastly, and I think most importantly, is the cost. The fiscal note did indicate that it would be $16.50, and I can tell you that had the fiscal note said $35, the Colorado Hospital Association would probably have had stronger opposition to House Bill 1284. We certainly understand the importance of the bill and wanted to make sure that it got through, but I think legislators would have heard our concerns, and I strongly encourage you to consider reducing it to a reasonable estimation, and maybe that's not $16.15, but maybe that's $20. That's a little bit more than what they estimated. Mindy Kemp did suggest that there may be a drastic scenario where you need to increase that, and I think that's a provision of the board to come back and say, okay, we need to increase that. With that, I will finish my comments, and we'll happy to take any questions the committees have.
Well done, Mr. Busher. Thank you.
I'm fascinated with your comment about direct care, and I'm looking at the statute. Give me just a bit more explanation about how you think we can vary from this language.
Ms. Berkeley.
So the definition of direct care means a service supports including case management services, protected services, physical care, mental health services, or any other service necessary for the at-risk adult's health, safety, or welfare. So that is really broad, right? But I believe the intention of House Bill 1284 was to ensure that it is more of the individuals working in a healthcare setting that would be directly impacting potentially being alone with an individual. And it had been made very clear to the healthcare community that that did not mean janitorial staff, cafeteria staff. And I think when we look at the costs that it could incur on employers, if there is any way to just allow facilities to make that further define what exactly that means for their facility, I think that would be appropriate and would align with the department's interpretation as the bill was going through.
That puzzles me because I don't know how we could delegate statutory interpretation to a hospital or a home health care agency or whatever. I don't know. I'm puzzled by that.
Yeah.
I think maybe our attorney will advise us.
Mr. McCombs.
So one way that could be implemented is the rule doesn't say a hospital has the authority to conclusively interpret this, but what it could say is something like all large providers shall develop a policy that identifies which staff are considered direct care. That would then be something that a CDPHE inspector could review, provide technical assistance on, correct if they are wrong and they try to say nurses don't provide direct care or something outrageous. So it would not be delegating interpretive authority, but it would try to endorse the idea that hospitals could take some measures to contain these costs and do so, with that process being supported.
Alternatively, at some future time, we could do a separate rulemaking to try to flesh this out.
Mm-hmm. Other questions for Ms. Burkhart? Ms. Burkhart.
I would also just add that throughout the stakeholder process, that was a recommendation by the Colorado Department of Public Health and Environment, something that we could consider around creating internal policies to just secure and ensure that there's no liability concerns with this rule. I think that's a huge concern of the hospitals at this point.
Dr. Core.
So direct care is described in statute, but the other two, employee-employer, are not. To me, direct care is a service, and the employee is where you're trying to capture. Why couldn't we just move someone who provides consumer-directed support services as stated under employer? Why don't we fix employee instead of trying to change statute?
Mr. McCombs.
So employer and employee are defined in statute. They're just defined in a different part of statute. So they're under 26, 3.1, 111. And so those are the statutory definitions. I guess the other part of half of your question that gives me pause is one way to look at what the legislature has done, which I think Ms. Burkhart would agree with, is that they chose direct care as a way to cabin costs, so that while they're not saying that janitors pose absolutely no risk to a person in long-term care, but they're saying we're going to triage and do this mandatory check only for doctors, nurses, physical therapists, that kind of thing, as just a policy choice. And so I would be reluctant to invade that policy choice.
So,
Commissioner Westendorf.
thank you for clarification. What I'm hearing, even though it doesn't say in the definition the word, like it says at the end, when it gets to the at-risk adults' health, safety, and welfare, almost every job at a facility is going to tangentially do that. If it's the maintenance person and they're coming in to empty the trash, it's so there's not infection, people don't slip, etc. Are we allowed to look at the word direct? Because their service is not directly for that patient. Their service is to the whole institution. But in reading this, I don't see that focus. I think it's implicit in the word direct, but you can't define a definition by itself. So I guess that's where I see the hope was that the word direct would somehow mean something, and it gets back out at the end.
Mm-hmm.
Yeah.
Commissioner Johnson.
So Ted, in your service to the board, do you ever have the ability to work with Office of Legislative Legal Services they drafted the bill, they worked with the legislators, they know the legislative intent. Will they ever offer an opinion to you to inform you of what they think is a valid way to amplify the intent of the legislature, or do you just get the heavy hammer a year later that we messed up?
Mr. McCombs.
Great question. We do sometimes work with OLLS in advance of passing a rule. It's pretty rare, and I haven't yet had the opportunity to figure out whether they would actually give us a meaningful answer in advance or whether they would just review it on the end. One thing I will say is that constitutionally, this body does have the prerogative to interpret statute. So an agency's interpretation of statute does have some weight. It's not like we're going off the rails in saying we're going to do our best to give meaning to all the terms in the statute so that it meaningfully limits and accomplishes what the legislature is trying to do. Yes, when we step out of line, we get the heavy hammer, but it doesn't mean that we can't try it all.
Director Beacon.
I just wanted to just share with the board that this issue and this definition is not a brand new issue, and that the drafters and the sponsors in the legislature fully considered these conversations with many of the same associations who are here, and they settled on this language. So I just wanted to clarify, this is not one of those where somebody was doing it quickly in Ledge Council. This has been well vetted in the legislative branch when they passed the law.